Depression symptoms in the US are 3 times higher than they were before COVID. About 37% of American citizens identify as chronically lonely, and now during shelter in place, the effect on such individuals is quite profound.
COVID, in my opinion, this is kind of the silver lining that everybody is talking about mental health now. They're experiencing anxiety and depression. Maybe they didn't have anything like that before. Hopefully it makes us all more compassionate and empathetic for people who have more serious forms of these conditions.
With shelter in place and the COVID situation, people are now more isolated, and which in turn makes them very lonely, and then that can add to a factor of their current diagnosis or their current symptoms that they already have.
About 3 or 4 months afterwards is when we started to get more calls with people who had a mental health condition and were getting even more symptomatic.
NAMI started off in the 70s when people were being released from the mental hospitals back into the community. They started organizing in 1974 in San Mateo County. 75 was our county, so we assume several of our members started there and then came back here and started ours. And by 1979, these support groups were all over the country.
And I'm the NAMI Santa Clara County's Warm Line Manager. Warm Line is a resource line that also gives support. People call us to find resources, how to access resources, or even if they're just feeling down and they don't know what to do, what are the next steps to take. So they call the Warm Line, and so we guide them through it. The people at Warm Line are all people who themselves are either living with a mental health condition or they are family members supporting people with mental health conditions. Pandemic has created mental health awareness like never before. So we had a TAY support group yesterday, family support group, and few of the parents were there because their children asked them to go, which is like, what a fantastic thing, and heard about children learning to access treatment for themselves and asking the parents to get educated. That was fantastic. I'm a Christian. My faith gives me a lot of strength. I depend on my faith. And so some of us parents, we thought NAMI has great tools, everything is really useful, but on top of that, we wanted the faith element. So that is why we started this faith-based support group, and we use the famous passage from the Bible on love, 1 Corinthians 13. We use it as our principles and guidelines because that really very closely matches with the principles of support that NAMI has.
Prayer definitely does help, gives you hope. It helps you feel that you're not alone because religiously, you've got that community all around you. Before COVID, there was a lot of stigma. Not a lot of people were coming to ask for services. And now due to COVID, they're coming out of the woodwork. So when they come to us, we match them up with someone who is similar to them. So some of them say, so is this like a friendship type of program where I can get a friend? Well, no. Hopefully you do become friends, because that means that you develop and you learn how to make a relationship and be in a relationship. This gives them a chance to interact with someone. This helps them come out of any isolation, whether it's due to COVID or because they have imposed that isolation themselves. That's on the side of the community peer program. During those 2 15 to 30-minute calls, what they're doing is trying to set up a goal for them to achieve. Setting a goal doesn't mean that, I'm going to go to school and I'm going to get my degree. The goal is to understand, what is it that works for you? What is it where you're struggling the most? And it could be just getting out of bed in the morning. And we have to understand that we are also going through very sad moments. So let's try to be with those people who are suffering through COVID, give them the support that they need, And I think that one thing that has been out of practice so much, but that is really wonderful, and it's writing letters, handwritten letters that says, hey, I'm thinking of you, for someone who you know is probably alone.
I always tell people stigma is ignorance and fear. And when you get educated about something, you're not so fearful about it.
Taking care of your mental health is not easy, but it is possible. And so don't feel alone. Just pick up that phone and call us, and we will walk you through.
You can help your friend or family member by recognizing the signs of mental health problems and connecting them to a professional help. Talking to friends and family about mental health problems can be an opportunity to provide information, support, and guidance. Reminding your friend or family member that help is available and that mental health problems can be treated. It is helpful to understand the mental health issues. NAMI Santa Clara County has an educational program that supports and educates family members that is 11 weeks long. Not only will you learn about mental health issues in the program, but also meet others who are facing similar challenges and provide support to each other.